which is bone marrow transplant, 2.5 years ago, with a dream to actually build a center of excellence in Burjeel Medical City. So the dream came true after like 7-8 months, when we get the approval of the DOH to establish the adult and pediatric BMT. We have done the first 10 cases within 7 months, adult, and then we started the pediatric. So it has been a journey, successful one and interesting one. With that, I would like to invite and introduce my dear colleague and friend, Dr. Bijou George, who is he is a consultant, senior consultant, hematologist and bone marrow transplanter. He used to practice in CMC Velour before joining us. Closer? So can you hear me now? Okay, better. Dr. Bijou George helped us to achieve around 75 adult cases so far. Around, maybe a little bit less, a little bit more, I'm not sure, but that's what the last numbers that I have. And also I have my dear colleague and friend, Dr. Sagar, who is a specialist pediatric hematologist, oncologist, and helped in establishing the bone marrow transplant for pediatrics since we started. Please, Dr. Bijou, you can start your presentation. Thank you very much for being here.
Thank you, Dr. Amro. Welcome to this session in the afternoon. So I'm going to be speaking initially about our experience with stem cell transplantation in adults, but mainly focusing on transplant services in the UAE and why is the need for more services that have to happen. So we started the stem cell transplant program with the adult program in October 2021. In 2022, the pediatric program started, and as of now, we've finished about 124 transplants, which includes both about 75 in adults and about 49 which has happened in children. But the journey towards the transplant actually started about a year earlier. This is in October 2020, when actually the initial concept was laid. We had to go through the process of trying to get DOH approval. We had to work on the SOPs and the protocols. And finally, in October 2021, the first patient underwent an autologous transplant. And over a period of 3.5 years, so to say, the numbers have been steadily increasing. So this we started in 2021. We did about 3 transplants, 35 transplants in 2022. We did about 66 in 2023. And we've done about 20 in the first 3 months of 2024. And this is an increase both in the pediatric and the adult transplants, both in allogenic and autologous. Now, I'm going to talk about the adult, and Sagar will talk about the pediatric. So in autologous, our main groups where we treat is multiple myeloma, Hodgkin's and non-Hodgkin's lymphomas, germ cell tumors, and of course amyloidosis, which are the common indications anywhere in the world for having an autologous transplant. And when we look, everybody engrafted, usually within 11 days, very few infections, and that is probably related to the fact that it's a new transplant program, and because of that, the risk of multi-drug resistant infections are much lower. All patients survive till hospital discharge. Few patients have had a relapse, but currently about 96% are alive. Some are on treatment, of course, some are on maintenance, some have had a relapse and had treatment. So overall about 97% survival, with a 1-year relapse-free survival about 86%. Now, it is a different story when we come to allogenic transplants. We have done about 20. The indications are different. It's mainly acute leukemia, so we have acute myeloid leukemia, acute lymphoblastic leukemia, and then other diseases such as CML, myelodysplastic syndromes, and other lymphomas. We do both matched sibling donor transplants as well as haploidentical transplants in the adults. Overall, as of now, about 70% are alive, which is actually reasonable. We have to remember it is a short follow-up. So over a period of time, we have to see whether this still holds good. So actually, we had a number of firsts. We were the first to do an allogenic transplant in the UAE. We were the first to do a haploidentical transplant, which is probably the toughest of all transplants in the UAE. We were the first to use total body irradiation for conditioning in the UAE, and of course use donor lymphocyte infusion. So we started early, we have a lot of firsts, but there's a long way to go. And why is there a long way to go? So we need to remember, so roughly about 50,000 transplants are done worldwide for all indications. But if you look right at the center, which is the Eastern Mediterranean region, it is actually a very small number of transplants that occur, and most of the transplants, if you actually look, will be Saudi Arabia and Iran. So the rest of the Gulf actually has a very small number of transplants. So people have asked this question, do we actually need bone marrow transplant services in this region? For that, what we need to do is to go back and look at the disease burden within the UAE, and that will give us an idea in terms of whether these transplant services are actually required. Now, if you look at UAE, a 10 million population, importantly, about 90% are below the age of 55, which means all of them biologically are eligible for a transplant. So that's a large group we actually have to deal with. Second, we look at this. So this is Globocan data from 2020, looking at the common malignancies which are described in different populations. So this is UAE data. If you look, leukemia is fourth, non-Hodgkin's, Hodgkin's and multiple myeloma, which means that roughly about 600 new cases were diagnosed in the UAE in 2020. So if you take 600 cases, and the average ballpark figure is that roughly 30 to 40% of these new cases will ultimately need a transplant, which means that we should be doing about 180 to 200 transplants per year in the UAE. That would be based upon the population. In addition, when we look at children, we need to remember that there is there's thalassemia, which is common, there is sickle cell, which is common, and so probably you need an additional 50 to 100 transplants for non-malignant diseases within the UAE. That means we are looking at about 250 to 300 transplants that have to be done every year if you just look at the burden of disease in the population. So where do we stand with regard to transplant in the UAE? So ADSCC was Abu Dhabi Stem Cell Center, along with SKMC was the first to start in July 2020, but they have we do not have actual published data on how many transplants have been done. Dubai Hospital started in October 21, but they do only autologous, they do not do allogenic. I think they are in a process of starting. We are doing both allogenic and autologous, and Cleveland Clinic started by doing autologous, but later actually DOH I think said that only Abu Dhabi Stem Cell Center, us, can actually do transplants within the UAE. So the numbers are actually down. So if you look that we do about 60 a year, they probably do about 20 to 30 a year. That means only about 100 transplants actually are happening in the UAE, which is much lower than the numbers which are projected from 2020 figures. So even now it's probably even much higher. So question is, how can we augment this capacity to increase on stem cell transplant in the UAE? So if you look, now there are 3 centers which are there across the UAE, but if you actually look at the population, you realize that there's a regional population in Ras Al Khaimah, Ajman. So we need more centers, and that's why we put probably one right on top for the Northern Emirates, one on this side, and that will what will help to cover the entire UAE. One of the common problems that we face is a patient comes from say Ras Al Khaimah to us, and they say we cannot stay around for 3 months. It's difficult for them to come up and down. And unfortunately, because there are hardly any hematology centers up north, we cannot even send the patient and say, okay, you follow up with your doctor there. So that becomes a big burden, because after doing a transplant, if complications occur because they do not have access to facilities, that defeats the whole purpose of actually doing a transplant. So it is important that when we develop centers, we develop transplant centers with hematology centers around it. So what I would say is we probably need more transplant centers, not less. Just looking at the burden of disease, we need probably collaboration and cooperation and not competition between different transplant centers, because I think there are enough patients that need transplant, and we should definitely look at a hub and spoke model. Every hospital cannot be a transplant center, but they can be the focus from where hematology centers can actually feed in, so that they can become specialized centers. And I think very importantly, most of these centers should come up as a public-private partnership between the government and private institutions, and that is the way that will benefit a larger number. Now, importantly, we may still have patients who may not find a match, so it's important to develop a bone marrow registry. We need to remember that the Arabic population actually has specific HLA types which may not be seen in, say, the German registry or the American registry. So it's important to have a local registry which will look after both the Arabic and the expat population. So the main question is, if we do all this, does it actually make some economic sense? So when we look at, this is data from 2016 to 2018. So roughly about 320 adult and pediatric patients were referred abroad for a transplant, which means roughly about 100 transplants a year, patients who have gone abroad. So if you look at the cost, where we can do a transplant for less than $50,000 within the UAE, and then you look at spending between 100,000 to 300,000 just for the transplant abroad, and of course there's a separate cost for the family staying abroad for 3 months, 6 months till the whole process is completed. It actually makes economic sense to say that these services should be developed within the UAE, and that will actually make good economic sense in terms of saving of money. So what will happen is, when you improve transplant services, we will actually end up improving hematology services, because you will have much larger number of hospitals with hematology services. We will improve transplant outcomes, less patients go abroad, and hopefully down the line we can become a hub for medical tourism for the other Gulf countries, for patients to be referred and come here. So what I hope will happen over a period of time is that, what we hope is at BMC, we would be able to complete 100 transplants per year by 2025. And what I hope is, we will have at least 2 to 3 centers in UAE performing 100 transplants per year by 2030, with of course other cell therapies and registry coming in, which hopefully means that actually no patient will need to go abroad for a transplant, at least by 2030. So I think it's important that we partner together with the authorities and with the health system in terms of trying to improve the outcomes of patients within the UAE. Thank you.
Thank you, Dr. Bijou, for the excellent presentation. And before going to Dr. Sagar, I just want to ask Dr. Bijou a quick question. Being here for the last 2 years, practicing in the UAE and seeing patients on daily basis, what is your biggest challenge with the treatment pathway of patients here? Is it?
So I think the biggest challenge is with insurance cover. Majority of the patients that we have transplanted, insurance has rejected treatment, and so most of the treatment has occurred through charity, or which is from other external organizations or within the institution. So that, I think, is a huge challenge, because to me it is not financially viable in the long term in terms of supporting patients for a long period of time. So we have to work with that. That's why I think it's very important to work with the government and the health system, that the insurance has to understand that this is not something very futuristic or fantastic. This is something which is
Amazing.
considered standard of care for a lot of diseases right now in 2024, which means that they have to look at insurance cover for transplant patients.
Thank you very much. Very well said. Thank you, Dr. Bijou. And with that, and without further ado, I'd like to invite Dr. Sagar, who is a specialist pediatric hematologist and oncologist in Burjeel Medical City, and he was part of the foundation that established the program, the pediatric program, together with Dr. Zain Al Abidin. Dr. Sagar, please.
Well, thanks, Dr. Amro. Yes, absolutely. So I've been there right from the inception of the bone marrow transplant unit at C. So I still remember the structure. I still remember the hardships that we had been through. But what makes us is where we are now. So Dr. Bijou had an excellent coverage over the data, excellent in terms of why we should do a transplant and why we should have more centers in here. What I'm going to stress is the pediatric part of the hematology oncology. I'm not going to stress more on data, but why BMC? Why pediatric hem onc at BMC? That's why the name comprehensive care. So I'm going to start with a short introduction of the team that's involved in. This is Dr. Zainul, who heads the pediatric hem onc department. He brings in a lot of experience from the UK.
The mic.
Is it?
Just make it closer.
Closer.
If it's not clear, you can wear the headsets as well. That can give you a direct feed of the microphone. But if you can speak as close to the...
Sure. Right. Then we have Dr. Fahad Abdullah, consultant in pediatric hematology oncology, who gets his experience from the US. That's me. And we have Dr. Ramzan with his experience in transplant from the Sick Kids Toronto. So why, I'll just skip these slides and reach the last part, and then I'll come back here. So what do we have to offer you guys in here? So we treat all benign hematological diseases, be it hemoglobinopathies, hemophilia, thrombophilia, hemolytic diseases, pure red cell aplasias. We treat malignant hematological conditions like acute and chronic leukemia. We manage lymphomas, solid tumors, which includes neuroblastoma, Wilms tumors, for example. What do we have other than hematology? So we excel at transplants. Dr. Bijou has already opened up the discussion. So how we started the transplant almost 2 years back, 22 months back, and now where do we are? So in pediatrics, we offer autologous stem cell transplant, which is offered in solid tumors after high-dose chemotherapy. We have match-related allogenic stem cell transplants, and what is considered one of the toughest transplant, as mentioned by Dr. Bijou, is the haploidentical stem cell transplants. And I'm really proud to say that we are the only ones who started pediatric allogenic transplants. Now it's along with us, ADSCC at Yas Clinic does it, but we have been doing it consistently over last 22 months. Just what we have done so far is, so in 22 months, we have completed 50 stem cell infusions and 50 stem cell transplants, out of which autologous has been only 22%, which is 11, and match-related and so haploidentical transplant had been the majority of chunk. The haploidentical transplants, we have done 13 so far, which is the largest number done in the UAE. Why we could, so just a simple slide on overall survival and GVHD disease-free survival. So all the overall survival for all our transplant has been up 95%, while GVHD and disease-free survival is 92%, which is the highest in the UAE. At the same time, our transplant-related mortality and rejection rates are very low. So our TRM is only 5%, while rejection rate is 2.8%. And coming back to why and how we could achieve this is because of a robust support from the maximum number of pediatric subspecialties available at BMC. So a diagnosis of cancer or a chronic hematological disorder itself is devastating for the families. So the treatment that we offer comes with toxicity as well. So what we need is a great support from the pediatric subspecialties, not just the hematology, oncology, and transplant service. So we have a pediatric intensive care, pediatric gastroenterology, pulmonology, endocrinology, pediatric surgery, orthopedics, we have cardiology, neurosurgery, pain and palliative, radiology, interventional radiology. We support with radiation oncology, and as we said, we were the first one to offer TBI as a part of conditioning regime in adults and pediatrics, the only one in the UAE. We have nuclear medicine, we have infectious disease consultations, we have genetics, we have stem cell therapy, and definitely a robust support from the nursing department, the dietitian, the pharmacy, lab, and with incorporation of OncoHelix, almost all the diagnostic and prognostic labs can be done in-house. So to say that all these specialties, the only hospital that has in the UAE in one roof to offer a one-stop solution to most of the pediatric hematology, oncology, and transplant services is BMC. That's why BMC, and that's why pediatric hemonc, and that's why we have, I am proud to say that we do offer a comprehensive care in terms of hematology, oncology, and transplant. I think that ends my presentation. Thank you so much.
Thank you, Dr. Sagar. Actually, one of the as well questions, I know for a fact that you guys are looking after very sick patients, and with 95% survival, would this make all patients that for thalassemia, for example, are out of with no, all of them are no transfusion, or some of them had to take still transfusion?
No, I'm really happy to answer this question, as whoever the thalassemic patients that we have transplanted, none of them is taking a transfusion now. All of them have cured of transfusion, which is the aim of transplant.
Yes.
So,
And
yes.
so by this I wanted to highlight that it's not only about survival, it's about the quality of life, or actually the outcome, the cureness. So I think that's you know, like fascinating, and thank you very much for saying that. I don't know if any of the audience have any question, and if not, I think we are behind the time a bit. So any question, anything in mind? Great, thank you so much, and take care of yourself. Thank you, enjoy the rest of the day.
Lovely. Thank you very much to our panelists today. Well, thank you. Okay, so our